from a patient who has recovered from the COVID-19 to a patient who is not yet recovered. So that is a basic discussion that we are going to do. So again, the convalescent means a patient or someone who had an illness or a surgery and who is now becoming healed or recovering. So convalescent is the recovering. Convalescent plasma is the plasma extracted from someone who has recovered from, in this context, who has recovered from COVID-19, and we take their plasma and give it to another person and see what that does. So that is the discussion today. I'm going to go over the FDA approval status. I would go over the mechanism of the immunoglobulin production, and I will go over how the convalescent plasma from one person can be used and how useful it is and how scalable this process is. What that means is, can we have this process as a widespread for hundreds and millions of people? Is it doable or not doable? So let's start with that discussion. Good evening, and thank you very much for joining. Let's start. So the first discussion that I'm going to do is that we are going to look at the FDA's approval. So I have this site here. And even before that, I want to make sure that we are all clear on one thing. I use the word killing of the virus very commonly in this discussion. And I want to show you that even WHO, so this is the WHO's site. This is the Mythbusters on WHO, World Health Organization, Mythbusters, and for various temperatures and stuff like that, various rumors. And if you see here, even WHO uses cold weather and snow cannot kill the new coronavirus. So I had someone leave a comment saying, good evening. So somebody left a comment for me saying this person's degree should be taken away because he used the word kill for a virus, and viruses are not, hey Jill, viruses are not alive, so how can you say kill them? We, for the enveloped viruses, we do use the term killing them. And hey Zizi, how are you? And that simply means that we remove their viability is reduced to a point where they cannot infect you anymore, and they're just strands of RNA which are disintegrating. So the killing is, hey Julia, how are you? Killing is the term we can use, at least for our discussions, instead of every time saying the viability goes down to almost nothing. And if you do want my license to be canceled, that is fine, but please read up other sites as well where even WHO uses the word killing. So having said that, I'll use the word killing of the virus in our discussion as well. And I understand that medically we can use other words as well. Having said that, let's start the discussion. First of all, FDA approval. So if you see here, I have the FDA site here. So what they are saying is, for the revised information for an investigational COVID-19 convalescent plasma. So FDA has offered an approval for convalescent plasma. That means taking plasma for someone who is sick, who has recovered from the sickness, and giving it to someone who is ill. And they have approved it under NID, which is New Investigational Drug. And so here is their site. In this site, they have a couple of things that are important for the physicians here in the US. That is, if you have a patient and you are going to treat them with convalescent plasma, and if you have 4 to 8 hours, then you can fill this form and send it to them for approval. If you do not have 4 to 8 hours, if it is urgent and it is critical, then what you can do is you can call this number and speak for a verbal authorization, take that verbal authorization, and then you can start treating the patient who is critical. So Michael, thank you very much. Michael says, people are a mess, who cares what you call it? It just needs to be gone. That Michelle, yes, absolutely, Michelle. Thank you very much. I was just weirded out by, hi, it's morning here. Good morning. So let's continue our discussion. So first of all, in the discussion, that FDA has on an emergency basis approved the use of convalescent plasma as a new investigational study. So that is one. They also have a site where there is a complete list of features and discussions for the convalescent plasma. That link is also on the page that I showed you, and I'll put those links in our description as well. So Glimmer says, I need a free premium account. Please note that is not free. Okay, so continuing for our discussion, today let's talk about what is convalescent plasma and how useful it is. So I am going to, as we know that Dr. Bean's tribe, all of us here, we usually go in the depth of understanding for how various things work. We understand the mechanisms, and then we understand how they're working so that we are anchored in facts and in medical concepts. So let's understand the medical concepts. So I'm going to use my whiteboard, and then we'll go from there. So here we are. Here is the whiteboard. So look, first of all, we are going to look at what are immunoglobulins, because, or these are also called antibodies, because this is what we transfer from when we give somebody convalescent plasma. We are actually taking immunoglobulins from a recovered patient and give them to a still ill patient. So what are immunoglobulins? So before that, let's talk about what is plasma. So you take blood and you remove cells from blood. Remove cells. Do not let it clot. That means keep the clotting factors in there. Do not clot. And then what is produced is, it's kind of yellowish in color. This thing that is produced, which has a couple of properties. Number one, it has albumin in it. It has immunoglobulins in it, the antibodies we're talking about, immunoglobulins, or we write them as Igs or antibodies. And it has clotting factors or fibrinogen in it. So plasma is used for clotting problems as well. So this is plasma. If we take blood, clot it, that means we remove the clotting factors from it, then what we are left with is serum. So let's say this is the packet, and again this is also yellowish in color, and it has proteins like albumin, as I said there. It has immunoglobulins as well, or antibodies. However, it does not have fibrinogen, so it cannot clot. The serum has the clotting factors removed from it. Plasma still has the clotting factors present in it. When we are talking about, so keep this in mind, so let's become a little smart here. If we will be talking about testing of immunoglobulins in a patient for COVID-19, usually testing is done in the serum because the antibodies are still present there. Testing is usually done on the serum. On the other hand, when we are giving a transfusion, when we are taking the plasma and we are taking those fluids from one person or liquids and giving them to another, that is called transfusion. Transfusions are usually plasmas. So hopefully that is clear. Now let's talk about immunoglobulins or antibodies. Look, here is how this whole thing works. When we have a pathogen, so let's say we talk about innate arm of the immune system. We are now talking about the immune system to understand how these antibodies are produced and why and what is the benefit of them. So let's say we have the innate arm. The virus, here is the virus. This is the coronavirus, right? And it is a really, really angry virus. It is trying to kill us. And this virus, when it appears in our system, we have macrophages, which are called antigen presenting cells, macrophages. They are part of the innate arm of the immune system. Macrophage have receptors that can bind to these viruses and pathogens, and they can take them inside. When they take them inside, they would chop them up. They would kill them and they would chop them up. Glimmer, if you didn't get it for free, you have started cursing me. Go away, yaar. Okay, so they would chop them up. They would break them down into smaller pieces. Then what they would do is they would take these pieces, put them on a protein called MHC2 and make them available outside. MHC2, and then those pieces of the virus or pathogen are going to be shown to the world outside. So this is how the innate arm works with the pathogen. Once the macrophage would present it, it is called an antigen presenting cell, APC. There are three kinds of APC in our body. One are macrophages, other are dendritic cells, and the third are B cells. An APC is a professional antigen presenting cell. It can take a pathogen, chop it up into smaller pieces, and then show the pieces outside. Now what happens is, please pay attention here. Now what happens is a T cell, a naive T cell, connects with this thing through a T cell receptor, a TCR, and then there are co-stimulations by more proteins and by cytokines. This is called co-stimulation. Pay attention here, please. Co-stimulation. And in case of coronavirus, we are talking about the next step from here. Usually the naive T cell can either go the route of T helper 1 cell activation or T helper 2 cell activation. T helper 2 cell activation, one or the other. So in case of the coronavirus, what happens is naive T cell moves in the direction of T helper 2 cell activation. This is what it is taken. And remember yesterday's discussion that even vitamin D causes, it moves the immune system response towards Th2. Good. So guys on the YouTube, I know that Glimmer is cursing me, cursing others. So just leave him alone. Forget about it. There are people who are not appropriately trained. So just leave it. Let him be. Okay. So now we have T helper 2 cells over here. When the T helper 2 cell become active, what they do is this. They release interleukin 4 and interleukin 5. And that causes the activation of the B cells. This is what is important for us to look at today, because B cells in turn will make immunoglobulins. right? These immunoglobulins are normally Y in shaped, so I'm just going to make them as Ys from now on. And this is what we really care for, because we are going to take these immunoglobulins from plasma and infuse them in another person or another patient. So now let's see, this is where our focus is today, on this area, B cell. We have to understand how B cells do what they do, how the immunoglobulins are produced. So keep this in mind now. I'm going to repeat this one part, and once you are clear, so this one pathway, and keep this in mind. So what is that pathway? The virus came in, macrophages picked up that virus. Where did they pick it up? Macrophages are present on our epithelial surfaces. They are present abundantly in our airway services as well. So virus is going to pick up virus will be picked up by macrophages. Then the virus will be chopped up into smaller pieces. It will be shown out as an antigen. T cell, naive T cells will come and bind with it. That would cause the activation, and the activation of T helper 2 cell would lead to activation of B cells by a release of interleukin 5 and interleukin 4. So this is the pathway of our immune system. Although in coronavirus, there is also T helper 1 and cytotoxic T cell activation, but forget about that at this time. We are talking about convalescent plasma and immunoglobulin. So let's now talk about B cells and how the immunoglobulins are produced. So now I'm going to focus on the B cell. So in this diagram, this area is what is our focus now. This is the area of focus. So let's talk about that. Here is a B cell. This is a B cell. It's a happy little B cell just sitting. Every B cell has on its surface a receptor which can bind with a specific antigen. This is the key word over here that is important. This is the key word over here that is important, and that is that every B cell has a receptor on it, which would be a specific antigen binding receptor. And what are these receptors? Normally, these are IgM and IgD, immunoglobulin M and D. And I'm going to talk about those immunoglobulin in a second. So question now is, how are these produced? Before that, let's actually see that once a B cell comes across an antigen through an antigen presenting cell, let's say a T cell, and here is a T cell receptor, then, and there are co-stimulatory cytokines and other co-stimulations, let's say IL-4, IL-5, that causes a specific B cell to become cloned, meaning many copies of that B cells are formed, and then all of them start producing immunoglobulins. IgGs, immunoglobulins. This is how the function works. The question is, what kind of immunoglobulins, how did this receptor come to be, and how are those immunoglobulins produced? So let's look at it. Inside a B cell, inside this B cell, there is a genetic structure. There is a pieces of DNA that help produce the immunoglobulins. Immunoglobulins are globulin or globular or gamma glycoproteins. These are also called antibodies. 20% of our plasma contains immunoglobulins, IgGs. So that is an important thing. 20% of the plasma is immunoglobulins. Now, the immunoglobulins or antibodies are produced in the B cell in the following way. The structure of the immunoglobulin has This is the kind of structure in it. There are, we say, heavy chains and light chains. Two heavy chains and two light chains. I'm going to put L for light chain and H for heavy chain. Two heavy chains, two light chains, they come together and make one immunoglobulin molecule. This molecule can be varying, it can be different at this area. And based on the difference, we can call it immunoglobulin M or immunoglobulin D or immunoglobulin G or immunoglobulin E or immunoglobulin A. So the way I remember them is GAMED, G-A-M-E-D. Immunoglobulin G, A, M, E, and D. These are the immunoglobulin types. So now, at this part of the immunoglobulin, what happens is that we have something we call binding region. Something we call binding region. Every immunoglobulin has two binding regions or antigen binding regions, or they are also called variable regions. Variable regions. Why are they called variable regions? Because every B cell has the antibodies which have different kind of binding regions. So for example, if I have one B cell over here, this is another B cell, this is another B cell. One B cell may have a binding region like this. The other B cell has a binding region like this. Another B cell may have a binding region like this. So every one of these can bind to a different antigen shape. That is presented on a presenting cell. Now these antigens, so let's say if we have coronavirus comes into our system, and this virus is picked up by macrophage as we talked before, and then it is broken up into smaller pieces, and those pieces may have various shapes to them, and some specific B cell will be able to bind with that piece. Once a B cell can connect with a specific piece of the pathogen, then that B cell will become active. In turn, now if I go back here, once the B cell becomes active, it is going to produce immunoglobulins. So please, now we are at the important junction. It will produce immunoglobulins. The very first immunoglobulins that are produced are IgM. So same one B cell is going to produce immunoglobulins. One B cell is going to produce immunoglobulin M and immunoglobulin D as the first response to an antigen. So we call this as a first response or early response. So let's say if I have a pathogen today, when it enters my system, that pathogen is going to be picked up by macrophage. Macrophages are going to chop it up and then take that pathogen to our lymph nodes. In the lymph nodes are sitting B cells. So when the pathogen presents the virus to T cells and B cells, these guys are going to now start seeing that who can work with this antigen. It takes about 7 to 10 days or even 14 days for this whole process to complete. Imagine as the lymph nodes are our laboratories where macrophages are going to bring the pathogen, the lab guys are going to analyze the pathogen and say, okay, what should we put on it? How do we kill it? They're going to experiment with it. Just like we are experimenting with the coronavirus at this time. So our body is going to experiment and see what can we do to kill this thing. And it would come up with the right immunoglobulin that would bind with the virus and help kill this. How do we help kill this? But before that, so the first immunoglobulins that are produced are IgM and IgD. So I'm going to go back to the board and show how these antibodies will help kill the virus or neutralize the virus. So first thing, IgM and IgD are produced. Then, so now IgM and IgD are produced. It takes about 7 to 10 days. It can even take more. So if I'm sick for about 7 to 10 days, about 7 to 10 days later, we'll have these two immunoglobulins. So if I have a chart here, a graph here, you would see that about 7 to 10 days later, we will have rising IgM levels, which would soon fall off IgM. Then IgD, once the IgM starts falling off, then IgG would start being produced, IgG, immunoglobulin G. Immunoglobulin G, once these are produced, they stay available for a long time. These cells can become memory cells as well, so that if in future the same virus comes into our system, we can respond within 2 to 3 days instead of 7 to 14 days. So IgM is the first one, IgG is the later one. How do they work? What do they do to the virus? So here is what happens. Immunoglobulins or antibodies, so imagine you took the plasma from one person and put it in another, how would that help? Antibodies are shaped like Y, correct? One function of them is to connect with the pathogen. So let's say this is the pathogen. They are going to connect with it, these Ys, and they just will neutralize the pathogen. Now, pathogen cannot do anything because it is now captured or it is now surrounded by the antibodies, and pathogen cannot come in contact with the cells to do its function. So one is, we will call it neutralizing the antigen or its toxins. Some pathogens produce proteins that are toxins. Antibodies can connect with them as well and neutralize them. So that is one. Second function of the antibodies is, this is so funny, when an antibody connects with a pathogen, so let's say this is a sad pathogen now because antibodies are connected to it. These antibodies are loved by macrophages. Macrophages have a sweet tooth for these antibodies. Macrophages love to bind with these antibodies, and so they are going to come in, bind with the antibodies and engulf this whole thing together and eat it up and then kill these pathogens. This is called opsonization. Opsonization. What is opsonization? It is the process of antibodies coating a pathogen to make it yummy for the macrophage. Macrophages normally cannot bind directly with the pathogens other than their receptors with toll-like receptor, but they cannot directly bind to eat them. So to have the macrophage directly eat the pathogen, what we do is we coat the pathogen with candies. What are those candies? These are immunoglobulins. So when these immunoglobulins are present on the virus, it is coated with those candies. Virus already knows, man, I'm dead now because macrophage is going to come in and eat me up. So that coating is called opsonization. Then third is that they activate complement system. And how do you remember which immunoglobulin? Remember this, GM makes classic cars. GM makes classic cars. So IgG and IgM activate the complement system. Once the complement system is activated, that creates a molecule called C3b. C3b also becomes coated. So if I make C3b in green, it also becomes coated on the pathogen, and that is also opsonizing. So macrophages also have a sweet tooth for C3b. So macrophage is going to come around and it's going to connect. It's going to come around and it is going to connect with C3bs and eat this thing up as well. So three main functions: neutralizing the antigen and the toxins, helping opsonize, and then activate the complement, which also would opsonize. Good. So now this is how immunoglobulins will work. Very quickly, IgM is the first one to be produced within 7 to 10 days, but then it goes down very fast as well. So it is produced and then it goes down. IgG is produced after IgM, but it stays on forever. Not forever. Various pathogens have a response for IgG for months to years to 20 years, to 10 years. So how long do we have IgG available for coronavirus, SARS-CoV-2? We do not know yet. So if I got infected today and I started producing IgG, we do not know yet that will I have this IgG available in my system for 1 month, for 2 months, for 1 year, for 2 years, we don't know yet. But as long as IgG is present, I am immune to the next attack. This is why somebody who has become ill and has recovered has developed the immunity, and that immunity is given by IgG. At the same time, after IgG, we may have IgA, we may have IgE. Remember, IgD is produced with IgM. So IgM and IgD are produced together. They are the only immunoglobulin that are produced together. Otherwise, all other are produced separately. IgA lives in the mucous membranes. So IgA lives in the mucous membrane. So against the coronavirus, if I have the immunoglobulins, these would be in my wet surfaces or mucous membranes where IgA lives. IgG, which is the most abundant one, which is the late response to the virus, these can go from placenta to the baby as well and provide them protection. So I remember this by the following thing. Look, the word G, the letter G, looks like a pregnant tummy. Correct? So from this, remember that IgG can cross placenta and go to the baby. Secondly, on this side, IgG looks like an open mouth. Correct? Like a Pac-Man. So from this, remember that it helps macrophages opsonize and eat the pathogen. Macrophage opsonize. Or opsonize for macrophage. So IgG can help opsonize. So remember that by the open mouth on this side. And IgG can travel through the placenta and go to the baby, or travel to the placenta and go to the baby. And remember that by its looks like a pregnant tummy. So back to the immunoglobulins now. IgM is the first response, 7 to 10 days. IgG is the later response, which would sustain for a long time. Then IgA will be produced, that would go into the mucous membranes to combat the virus when it is coming, virus or bacteria, when it, or fungus, whatever is the antigen and pathogen, when it comes to these areas. IgE goes and connects with mast cell, and that is responsible for allergic reactions. IgE's primary function is to help kill the worms. IgD has no function other than connecting with the B cell and acting as a B cell receptor. Now, going back to the essence of the lecture today, if we take, going back to the board. So if we take a person, so let's say this was a person, this person became ill with coronavirus. This person would develop IgM first, correct? Then they would develop IgG in them. When they have recovered, their blood would have IgG in it. We will take their blood and actually just take the plasma out of it, which would have IgG. Then we take this plasma and infuse that into another person who is sick and probably critically sick at this time and needs help. Their own immune system hasn't started working yet because it takes 7 to 10 days, but they became ill, let's say, within 5 days. So their immune system has not kicked in to start helping, or maybe it is not powerful enough to start helping. So now the IgG, absolutely good, Justin, that gamed is a beautiful one to keep in mind, GAMED. And if you wanted to see which IgGs are produced first, then the word is MD, Gia. So remember, there is an MD, her name is Gia. So M and D are produced first, then G, then E, and then A. So MD, Gia is for the production sequence. Back here to the discussion. So when the IgG we take from a person and we put that in this person who has not been able to mount an immune response, or they do not have enough time to create immunoglobulins, can now use these immunoglobulins from another person for the time being while their own system starts helping. This is called passive immunity. What is active immunity? Active immunity is this guy who recovered, produced their own immunoglobulin, and in enough quantity that it could kill the virus. This is active immunity. We can actually create active immunity in people by giving them broken up pathogen, so smaller pieces of pathogen, which allows their immune system to become aware of those pathogen and develop antibodies. Then when the actual pathogen comes in, their immune system quickly recognizes it and starts killing it. That is also called development of active immunity. But someone who has not been able to produce the active immunity, we can take antibodies from this person who is healthy, who has recovered, has the antibodies. We put them in this person, and those antibodies will be called passive immunity and help him. Now, here are the questions for the passive immunity. Why this is something that may or may not work. Number one, the clinical trials are still going on. People, as you see, FDA has on an emergency basis approved the usage of convalescent plasma. The problem is that, let's say if I have recovered, how much antibodies do I have? How many people can that help? If we are expecting, let's say, 10 million people to become sick, how many patients we can have and take their plasma and then give it to the healthy people? That scalability is the problem. It is suspected that one person's plasma or one packet of plasma may be helpful for 2 doses for a sick person. We do not know that an ill person will need 2 doses or 10 doses. Will one donation of the plasma packet, is that enough for one person, or it's just 2 doses and we need more? A person at one time can give up to 4 plasma donations, and then they need to recover. So is that 4 enough for 4 patients, or is that 4 enough for just 1 patient? If I am recovered, can I only help heal 1 person? Even then, it is really important. It can save lives. There was a doctor who became ill actually Mount Sinai Hospital in New York. They started a trial in which they said, all right, let's take the plasma and give it to the patients. And they sent out the message for volunteers, and there were 10,000 volunteers who came in and said, take our plasma. That is humanity started donating the plasma. Mount Sinai Hospital doctor, I believe it is Dr. Jang, they have started a new process where they very quickly understand if a person's blood has enough antibodies to take or not. They are figuring out what is the quantity of antibodies in a person. Then the people with more antibodies, they're taking their plasma and then giving it to others. Now, Is this helping? Some studies say they are. I looked at, there is a doctor from Colorado who is an ICU doctor, Dr. Michael Leonard, who is on a ventilator at this time, and he is receiving antibodies. According to his wife, I was seeing the interview. I'll put that in our description as well. These are baby steps improvements. So don't know if that means that the antibodies are not helpful, or do not know that he needs a bigger dose of antibodies. We'll find out more. It is, I think, about 3 or 4 days now that he's been receiving this. So there is a number of studies going on. There is a hope with this. These antibodies are definitely useful. What we do not know is from one person, how many people can take benefit of it, and if this can be scaled up. So I'm going to stop here and let's see if we have any questions. So Lisa says, how long does the antibody stay active in the plasma? Can it be frozen and saved? And how many people so that's exactly what I just discussed, Lisa. Of course, we can have the plasma frozen, antibody is going to stay there. What we do not know is one bag of plasma, how many people can it help? And these are the tests going on. This is happening because FDA has approved it. We can start working on those. So I think more literature will come out soon. So then there's a question, can plasma transfusion cause serum sickness? Depends. So I think we'll have to look at case by case to see how many plasma transfusion can be given and if there is a serum sickness or not. Then good morning, Rajiv good morning, Rajiv. What about the person that donate the plasma? Will he be immune to further attacks? So yes. So Imran Khan is asking so a person, if I was sick and I developed immunity, I am immune from reinfection for some time. The question is how long, that is not known yet. Is it 1 month, 2 months, 1 year, 10 years? You know that in some cases, antibodies, the B cell become memory B cell and they can even go for 10 years. In some cases, vaccination may not need to be given till 10 years. In some cases, even 20 years. So it is possible that COVID-19 or SARS-CoV-2 antibodies may live in us for years or maybe months. This would only know as we see the patients who have recovered and how they are progressing. So at this time, we don't know. Lisa says, thank you. You answered it right after it posted. Thank you. You're most welcome. Ahmad says, according to that words, plasma donation acts as a prophylaxis, not treatment. So where is the benefit? The benefit is that if somebody is critically ill and they might die, we can give them antibodies to provide them passive antibodies to provide them some support while their own immune system kicks in. So this is really trying to figure out if a critically ill patient, can we save them? Okay, so what is the dose? So very good question, Grace. And this is what I was just discussing. One bag of antibodies or plasma from one person, we do not know. It makes 2 doses for an ill person. But what we do not know is if 2 doses are sufficient to help them recover, or they need 10 doses or 20 doses, or it changes from person to person. That will be only known once these tests continue and produce literature. Gabriel says, what is the lifespan of memory cell? This is exactly the question. We don't know. Is it 2 months? Is it 10 months? Is it a year, 2 year, 10 year? We do not know yet. So that is the problem. Manoj says, is there any criteria for transfusion of plasma for recovered? Yes. At least in the US, FDA has given a criteria for who is eligible to receive this, because we have to go and collect the plasma from people, then save it and then transfuse it. So this is not a lot of plasma. We have to go to people. It's a organic biological component. So we have to be very careful. So FDA has a set of criteria for who receives it. So what is the percentage of reinfection? So as far as I know, reinfection is not possible. In the beginning, it was said that people who have become recovered, they still had the virus in their swabs, and we thought they were reinfecting. I think it was the remnants of the virus which body was still clearing out, but it had reduced to a point where body had recovered or had not had the symptoms. So I don't think that there is a reinfection, but the question of reinfection is answered by how long the IgG would stay, and we don't know that yet. Then there is this question, if anyone given a plasma protein to infected person, how much days it would be work? So again, I'm saying I do not know the dosage of it. Literature would come out and we'll know, but we are knowing that it is helping in some cases. How much is a bag of plasma? 500 cc, you can look it up. What about mutation of SARS-CoV-2? What happened? So look, this is a very good question about the mutation. If SARS-CoV-2, it is mutating, if it mutates enough to become disabled, then it is not SARS-CoV-2. It is not causing a disease. As long as it causes the same COVID-19 disease, even after its mutations, it is still SARS-CoV-2. And the vaccines and the antibodies would continue to work on it. Then, will it be able to reduce the viral load from Bangladesh? Possible. That is the thing, that once we give the antibodies, their function is to go and connect with the antigen and kind of neutralize the antigen. So that is the already produced virus that are bound. So number one, it helps clear the viruses. Number two, a virus that has become bound or trapped or arrested by the antibody may not be able to enter a new cell and infect that and replicate. So that can help reduce the load as well. So yes. HCQ as a prophylaxis, I believe in that, but there is literature that is coming up. I believe it should be done, but that is my opinion. And I'm not prescribing it to anyone. It's just my opinion. This is for educational purpose. So don't use my words to take that as a self-medication. How much time it gets a person to recuperate after donating plasma? I think that one person can give 4, and then a few days later, maybe 15 days, they can donate again a month later. And that is the problem, that we cannot ask one person to keep producing it. Kevin says, thank you, Dr. Moveen. You're most welcome. Happy to have this discussion. Which work better? This is like the quick question answers for me. Oseltamivir or remdesivir. I know that remdesivir works, and that is being given in the US hospitals. I do not know about oseltamivir. Which is the best plasma or serum? Plasma, because it has the clotting factors in it as well. Serum is useful for testing. Plasma is useful for donation. What else? What else do we have? Okay, so good, guys. So if somebody is infected and is healed, can we test? Of course, that is a point. If somebody has been sick and then they become recovered, that is a convalescent plasma. Convalescent means somebody who has recovered. So we can then use their plasma to give it to others. We know they have antibodies. So good, I think we can stop now. Thank you very much for your time. Rajput says, SARS-CoV-19 has 2 strains. Does it make it difficult to make vaccine? No, look, it's very simple. The idea of vaccine is to the disease. That a pathogen that causes a specific disease, we are making the vaccine against its proteins. A pathogen that has mutated not to cause a disease, we don't care. We don't care if it responds to vaccine or not. But if there is a virus that is not mutated enough to keep causing the same damage, then the vaccine will work against it. So Umar says, am I the only accountant on? Like to listen to Dr. Bean, great videos, very informative, thank you. All right, so Jill says, thank you. I think we are good. Let us now break for today. We have talked about convalescent plasma. Tell me in the comments what would be the next topic that you would like to work with, and tomorrow we'll do that topic. Thank you, guys. Thank you very much. Thank you for joining. Thank you for valuable time that you give me to hear me out. And please share this as well. I hope that you like that we are producing these content with facts, with other dream taken care of. Hey, Ty, welcome. Thank you very much for joining, and thank you for your time. Okay, I'm gonna leave now so that the video is not too long, and we will talk again tomorrow at the same time. Tell me what would you like for tomorrow, and we'll go from there. Maybe testing. Would you like antibody testing and other testing mechanisms that we are using for the pathogen? So maybe we talk about testing tomorrow. All right, guys. Thank you very much. Love you all. Stay happy and healthy. Stay away. Use mask. Do social distancing. And stay happy, stay healthy. Please, especially salute to those who are working in the healthcare and are on the front lines. Thank you very much. Okay, guys.